So when you come in for a hip replacement, you will come down to the operating theatre. The anaesthetist will usually perform a spinal anaesthetic, which involves a small injection into the back and sometimes a little bit of sedation. The operation itself lasts for about an hour. After the procedure, you go to a recovery room, and after that, you go back to the ward. A physiotherapist will see you, they will get you up and make sure that you're nice and safe and able to walk on crutches without too much of a problem. Most people need a couple of days in hospital after having had their surgery, and then they're usually able to go home with some simple painkillers. You'll be seen at 2 weeks down the line by myself to make sure that your wound is healed up nicely, and then again see you at 6 weeks down the line to ensure that you're progressing well. At this stage, most people are doing very well and are able to be discharged. You may need to work with a physiotherapist following your surgery.